You're a year out now, no sign of any cancer, which is perfect.
Oh, good.
Yeah.
Wait a minute. This is my year.
This is your year.
Man, this is my year.
Yeah.
Yes, it is.
Yep.
This is my year.
Despite everything he's endured,
Thank you, Lord.
Eddie Taylor is optimistic when he looks to the future. And when you learn everything he has survived, you'll understand his new nickname.
Everybody gave me a nickname, Miracle.
A prostate cancer diagnosis, surgery to remove his prostate, then a heart attack, stroke, and a heart transplant just 3 months later.
I saw you at a bad moment in time, so I'm glad we're on this side of it.
So you were there.
He and his urologic oncologist, Dr. William Parker, clearly have some catching up to do in this appointment.
I came up and saw you when you were in the ICU before the heart transplant.
Okay.
Because they also need me to weigh in on that to tell them that it was okay from your prostate cancer for you to have the transplant.
Eddie doesn't remember that moment or most of the moments leading up to that. All he remembers is being back at work after his prostate removal and feeling pretty good until...
The last thing I remember is a doctor tapped me on the shoulder and said, Eddie, don't be alarmed. He said, you had a heart attack. I didn't know what to think, you know. My mind was just going crazy, you know, because I was like, no, I'm at work, you know. I'm supposed to be anyway. They told me that my heart was weak, you know, and they had to put me on a machine called an ECMO machine. Time was racing against me. I had to get a heart, you know, soon.
He was airlifted from a different local hospital to the University of Kansas Health System.
I actually rode on a helicopter and I wasn't even awake to even see the whole ride.
Just days later, Eddie had a new heart. And on this day, he's meeting with Dr. Parker to discuss getting back his sexual function.
There are injections, there are pumps, there are things that we can do. But I want to touch base with Dr. Shaw's team and just see what all can I do right now.
Because of his heart transplant, it will require collaborative care with his cardiology team.
The hard part is that if you hadn't had everything that happened with your heart, this conversation 6 months ago, it would have been a pretty easy pathway to figure out. Try not to get too frustrated right now, but hang in. I've got tricks up my sleeves.
Okay, answer free.
Yep.
You've done a good job, man.
No, you did the hard part.
Yeah, you did a good job.